Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Pharmacology. An order is written to start and for on a 74-year-old client who is getting ready to go to the operating room for a total hip replacement. What gauge of catheter would best meet the needs of this client? Option A, 18. Option B, 20. Option C, 21 butterfly. Option D, 25. Right answer is option A, 18. Clients going to the operating room ideally should have an 18-gauge catheter. This is large enough to handle blood products safely and to allow rapid administration of large amounts of fluid if indicated during the perioperative period. An 18-gauge catheter is recommended. A 20-gauge catheter is a second choice. A 21-gauge needle is too small and a butterfly too unstable for a client going to surgery. A 25-gauge needle is too small. A client with an acute exacerbation of rheumatoid arthritis is admitted to the hospital for treatment. Which drug, used to treat clients with rheumatoid arthritis, has both an anti-inflammatory and immunosuppressive effect? Option A, gold sodium thiomalate, micrizine. Option B, azathioprine, imuran. Option C, prednisone, deltazone. Option D, naproxen, naproxen. Right answer is option C, prednisone, deltazone. Gold sodium thiomalate is usually used in combination with aspirin and nonsteroidal anti-inflammatory drugs to relieve pain. Gold has an immunosuppressive effect. Azathioprine is used for clients with life-threatening rheumatoid arthritis for its immunosuppressive effects. Prednisone is used to treat persons with acute exacerbations of rheumatoid arthritis. This medication is given for its anti-inflammatory and immunosuppressive effects. Naproxen is a nonsteroidal anti-inflammatory drug. Immunosuppression does not occur. Which of the following is least likely to influence the potential for a client to comply with lithium therapy after discharge? Option A, the impact of lithium on the client's energy level and lifestyle. Option B, the need for consistent blood level monitoring. Option C, the potential side effects of lithium. Option D, what the client's friends think of his need to take medication. Right answer is option D, what the client's friends think of his need to take medication. The impact of lithium on the client's energy level and lifestyle are great determinants to compliance. The frequent blood level monitoring required is difficult for clients to follow for a long period of time. Potential side effects such as fine tremor, drowsiness, diarrhea, polyuria, thirst, weight gain, and fatigue can be disturbing to the client. While the client's social network can influence the client in terms of compliance, the influence is typically secondary to that of the other factors listed. Which of the following is least likely to influence the potential for a client to comply with lithium therapy after discharge? Option A, the impact of lithium on the client's energy level and lifestyle. Option B, the need for consistent blood level monitoring. Option C, the potential side effects of lithium. Option D, what the client's friends think of his need to take medication. Right answer is option D, what the client's friends think of his need to take medication. The impact of lithium on the client's energy level and lifestyle are great determinants to compliance. The frequent blood level monitoring required is difficult for clients to follow for a long period of time. Potential side effects such as fine tremor, drowsiness, diarrhea, polyuria, thirst, weight gain, and fatigue can be disturbing to the client. While the client's social network can influence the client in terms of compliance, the influence is typically secondary to that of the other factors listed. The nurse is caring for an elderly client who has been diagnosed as having sundown syndrome. He is alert and oriented during the day but becomes disoriented and disruptive around dinner time. He is hospitalized for evaluation. The nurse asks the client and his family to list all of the medications, prescription and non-prescription, he is currently taking. What is the primary reason for this action? Option A. Multiple medications can lead to dementia. Option B. The medications can provide clues regarding his medical background. Option C. Ability to recall medications is a good assessment of the client's level of orientation. Option D. Medications taken by a client are part of every nursing assessment. Right answer is Option A. Multiple medications can lead to dementia. Drugs commonly used by elderly people, especially in combination, can lead to dementia. Assessment of the medication taken may or may not provide information on the client's medical background. However, this is not the primary reason for assessing medications in a client who is exhibiting sundown syndrome. A 25-year-old woman is in her 5th month of pregnancy. She has been taking 20 units of NPH insulin for diabetes mellitus daily for 6 years. Her diabetes has been well controlled with this dosage. She has been coming for routine prenatal visits, during which diabetic teaching has been implemented. Which of the following statements indicates that the woman understands the teaching regarding her insulin needs during her pregnancy? Option A. Are you sure all this insulin won't hurt my baby? Option B. I'll probably need my daily insulin dose raised. Option C. I will continue to take my regular dose of insulin. Option D. These finger sticks make my hand sore. Can I do them less frequently? Right answer is Option B. I'll probably need my daily insulin dose raised. The client starts to need increased insulin in the 2nd trimester. This statement indicates a lack of understanding. As a result of placental maturation and placental production of lactogen, insulin requirements begin increasing in the 2nd trimester and may double or quadruple by the end of pregnancy. The client starts to need increased insulin in the 2nd trimester. This statement indicates a lack of understanding. Insulin doses depend on blood glucose levels. Mrs. Johansson's physician has prescribed tetracycline 500 mg. While assessing Mrs. Johansson's nursing history for allergies, the nurse notes that Mrs. Johansson is also taking oral contraceptives. What is the most appropriate initial nursing intervention? Option A. Administer the dose of tetracycline. Option B. Notify the physician that Mrs. Johansson is taking oral contraceptives. Option C. Tell Mrs. Johansson she should stop taking oral contraceptives since they are inactivated by tetracycline. Option D. Tell Mrs. Johansson to use another form of birth control for at least 2 months. Right answer is Option B. Notify the physician that Mrs. Johansson is taking oral contraceptives. The nurse should be aware that tetracyclines decrease the effectiveness of oral contraceptives. The physician should be notified. Tetracycline decreases the effectiveness of oral contraceptives. There may be an equally effective antibiotic available that can be prescribed. An adult client's insulin dosage is 10 units of regular insulin and 15 units of NPH insulin in the morning. The client should be taught to expect the first insulin peak. Option A. As soon as food is ingested. Option B. In 2 to 4 hours. Option C. In 6 hours. Option D. In 10 to 12 hours. Right answer is Option B. In 2 to 4 hours. The first insulin peak will occur 2 to 4 hours after administration of regular insulin. Regular insulin is classified as rapid-acting and will peak 2 to 4 hours after administration. The second peak will be 8 to 12 hours after the administration of NPH insulin. This is why a snack must be eaten mid-morning and also 3 to 4 hours after the evening meal. The first insulin peak will occur 2 to 4 hours after administration of regular insulin. The first insulin peak will occur 2 to 4 hours after administration of regular insulin. The second peak will occur 8 to 12 hours after the administration of NPH insulin. An adult is hospitalized for treatment of deep electrical burns. Burn wound sepsis develops and mafenide acetate 10%, sulfamylon, is ordered bid. While applying the sulfamylon to the wound, it is important for the nurse to prepare the client for expected responses to the topical application, which include: Option A. Severe burning pain for a few minutes following application. Option B. Possible severe metabolic alkalosis with continued use. Option C. Black discoloration of everything that comes in contact with this drug. Option D. Chilling due to evaporation of solution from the moistened dressings. Right answer is Option A. Severe burning pain for a few minutes following application. Mafenide acetate 10%, sulfamylon, does cause burning on application. An analgesic may be required before the ointment is applied. Mafenide acetate 10%, sulfamylon, is a strong carbonic anhydrase inhibitor that affects the renal tubular buffering system, resulting in metabolic acidosis. Mafenide acetate 10%, sulfamylon, does not cause discoloration. M'(S. Clark has hyperthyroidism and is scheduled for a thyroidectomy. The physician has ordered Luger's solution for the client. The nurse understands that the primary reason for giving Luger's solution preoperatively is to: Option A. Decrease the risk of agranulocytosis postoperatively. Option B. Prevent tetany while the client is under general anesthesia. Option C. Reduce the size and vascularity of the thyroid and prevent hemorrhage. Option D. Potentiate the effect of the other preoperative medication so less medicine can be given while the client is under anesthesia. Right answer is Option C. Reduce the size and vascularity of the thyroid and prevent hemorrhage. Doses of over 30 mg/day may increase the risk of agranulocytosis. Luger's solution does not act to prevent tetany. Calcium is used to treat tetany. The client may receive iodine solution, Luger's solution, for 10 to 14 days before surgery to decrease vascularity of the thyroid and thus prevent excess bleeding. Luger's solution does not potentiate any other preoperative medication. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.